Hello everyone, and welcome back to another edition of microbiology. Today we'll be discussing select topics of urogenital system infections in chapter 23. In order to do so, we'll have to familiarize ourselves with the urinary system and reproductive systems of humans. While this isn't an anatomy class, we will briefly cover the two. Let's think of it from the perspective of routes of infection. So let's begin with the endpoint, the urethra. The urinary system, the urethra connects to the bladder through one urethra. If we follow the bladder up, there are two ureters that lead to two kidneys. The kidney's job is to filter waste products from the blood and flush them in the form of urine to the bladder. In this slide, we can see the male and female reproductive systems. To the left is the male reproductive system. From the urethra, we lead to eventually the vas deferens, which connects to the testes. With a female reproductive system, if we start at the end point, we have the vagina, which leads to the cervix, which is a narrow opening at the base of the uterus. The uterus is the region where gestation may occur with a fetus. From the uterus, we can follow two uterine tubes that connect the uterus to the ovaries. Let's keep in mind that there is a normal microbiota associated with the urinary system and reproductive systems. And contrary to popular belief, the urinary system is not a sterile system, and it does contain a microbiome that is not well understood. There are an estimated dozens of species that are present in the region. In women, the urinary system is closely related to the reproductive system and largely includes lactobacillus. Lactobacilli are important to the vagina in that it maintains an acidic pH that is inhibitory to many other species.
Checkpoint 1. What microbe primarily colonizes the vagina and what sort of pH does it maintain? What is the major end product in its fermentation pathway? If you do not recall, then review microbial metabolism for this question.
The three diseases that we'll concern ourselves with for the urinary tract system are cystitis, pyelonephritis, and leptospirosis. All three of these largely have to deal with bacterial infections, which are the most common cause of urinary diseases. Cystitis, or urinary bladder infections, are usually caused by E. coli, but also sometimes Staphylococcus saprophyticus. They are much more common in females and rare in males. The reason for this is that females have a much shorter urethra than men, about 2 inches compared to about 8 inches. And also the urethra tends to be closer to the anus than in men. The symptoms include dysuria, which means it's difficult to urinate, and pyuria, which is pus in the urine. It's diagnosed with urine culturing that exhibits greater than 1,000 CFUs per milliliter. That's 1,000 CFUs per milliliter, and a leukocyte esterase test. And all that a leukocyte esterase test is it's a test for an enzyme that is produced by neutrophils, which is a part of your immune system, and that's indicative of your immune system trying to fight an infection. Pyelonephritis is inflammation of one or both of the kidneys that progresses from untreated cystitis. Symptoms include a fever, side or back pain, permanent kidney damage, and can be deadly if it progresses to sepsis. It is caused in 75% of the cases by E. coli. And because this is a progression of an infection of the urinary tract disease, starting from the urethra to the bladder and up into the kidneys, we expect a much higher number of cell counts in the urine. So CFUs ranging greater than 100,000 per mil is considered indicative of pyelonephritis. Leptospirosis is caused by a tightly wound spirochete called Leptospira interrogans. Gets its species name, interrogans, from the fact that the spirochete-shaped bacteria has a hooked end that resembles a question mark. It's transmitted via ingestion of or contact with animal urine contaminated water. And signs and symptoms include a headache, muscle aches, fever, and chills that can last several days and may recur after an asymptomatic period. It is diagnosed with a blood test, and over half of the cases occur in Hawaii. It is treated with doxycycline if diagnosed early, and it rarely progresses to kidney failure.
Checkpoint 2. A patient presents with a fever and lower back pain. A urine culture reveals E. coli exhibiting more than 100,000 CFUs per milliliter. What condition is indicated?
The etiology of diseases of the reproductive system are a little bit more broader. They can be bacterial, viral, fungal, and protozoan. As you can see, many of the diseases on this list are transmitted sexually. First, gonorrhea may be caused by the bacterium Neisseria gonorrhea, and it can infect the eyes, rectum, mouth, pharynx, or genitals. The number of cases have been increasing rapidly in the past decade by almost 30%, and 60% of these cases occur in those aged from 15 to 24 years of age. The fact that the disease is often not recognized in women contributes to its transmission, and more women are using birth control, which means that they are less likely to use barrier types of forms of protection like condoms. In men, there is a 20 to 35% chance of transmission per exposure. It infects the urethra, causing a painful urination, pus containing discharge from urethra. And in women, there's a higher percent chance, a 60 to 90% chance of transmission per exposure. And it can infect the cervix, often with few symptoms. So it's difficult to recognize and can later lead to complications. One of the issues with gonorrhea is that it can progress into a system infection affecting other organs of the body, such as the heart, brain, eyes, and joints. Another issue is there's no adaptive immunity. Men can be diagnosed with a Gram stain. If you look at the image to the right, you'll see that a Gram stain results in pink cells. And if you recall, pink cells tells us that it's a Gram-negative bacterium. Women have to be diagnosed with other methods, however. They're typically diagnosed using enriched selective media for gonorrhea. It is also very tricky to treat because it is Gram-negative. There are fewer options for antibiotics. And antibiotic resistance is becoming more prevalent.
Checkpoint 3. From the presentation, what diagnostic technique should be used for gonorrhea in men, and what technique for women? Where should the sample that is evaluated be taken for each of them?
Non-gonococcal urethritis is an inflammation of the urethra that is not caused by Neisseria gonorrhea. It's most often caused by Chlamydia trachomatis. It can affect the eye or trachoma or genitals. In men, it's mild and up to 50% are unaware of infection. And women are typically asymptomatic, up to 70% unaware of infection. Pelvic inflammatory disease is a catch-all term for a polymicrobial infection that occurs in female pelvic organs, including the uterus, cervix, and ovaries. It is also most commonly caused by Neisseria gonorrhea and Chlamydia trachomatis. Salpingitis is in the infection of the uterine tubes and most severe form of PID. It can lead to scarring, and this scarring can lead to blockages and infertility or ectopic pregnancies. So it's a life-threatening illness. And again, it's often treated with doxycycline. Syphilis is caused by the tightly coiled bacterium spirochete called Treponema pallidum. And from genital mucous membranes, it enters the blood and invades other body tissues. The spirochete morphology allows them to swim and navigate between the fluid of cells. And it's steadily increasing in the US for the past 17 years now. It's also difficult to diagnose, and the technique depends upon the stage of the disease. And here's a graph of the rates of syphilis infection that's been reported by stage. So there is a total syphilis, and then we have our two different stages: early, non-primary, non-secondary, and primary and secondary. It's not so important for you to distinguish between the different stages, but this graph is important because it shows that, we once had a very large peak, roughly about 0.4% of the population carried syphilis. With the use of antibiotics and sexual protection methods, we've dropped those cases down precipitously. However, we've seen that about the past 17-20 years, we've had an uptick in the total number of syphilis cases. So this is select topics. We won't cover all of the different types of bacterial infections of the reproductive system. We'll wrap up here with bacterial vaginosis. It is an inflammation of the vagina due to infection with a bacterium, most often Gardnerella vaginalis. And signs include a vaginal pH that rises above 4.5. And we do have an odor with this and a discharge with this, and what we call clue cells. Now, clue cells are cells of the vaginal epithelial lining that are covered in a biofilm comprised mostly of G. vaginalis. It's thought to originate when normal microbiota, so mostly our lactobacillus, are reduced in numbers. And it may result from sexual transmission of G. vaginalis or may arise independently. So that does wrap up our discussion of bacterial sources of reproductive system diseases. Let's briefly cover a couple of viral sources. Herpes is probably the most common viral infection of the reproductive system. It is caused by herpes simplex viruses type 1 and type 2, HSV1, HSV2. It's estimated, you look at different sources and you get different values, but it's estimated that 1 in 4 that are infected in the US are mostly asymptomatic and unknowingly carrying it. It does lead to lesions that cause burning sensations that develop into vesicles, and these cause painful urination and painful contact with clothing. It does have a permanent latent infection. If you think back, this is kind of like chickenpox. Chickenpox has a latent infection that can reoccur as shingles. Well, the same can occur with HSV. Recurrence happens in about 90% of people with HSV2 and about 50% of people with HSV1. There are antiviral drugs on the market that do not cure herpes but can alleviate in the symptoms and likelihood of recurrence. One possibility is to gene edit herpes away. And this is because the virus actually hides out within your own genome. It is possible that through gene editing, we could go in with molecular scissors and remove pieces of their genome that renders the virus inactive. It is possible to have neonatal herpes, and this is when HSV crosses the placenta and causes a spontaneous abortion or severe neurological damage to the fetus. Fetuses affected by untreated neonatal herpes have a 40% survival rate. And while the effects are worse when primary infection is acquired during pregnancy, a woman who has already been exposed to herpes very rarely passes the infection onto the fetus, but it may be transmitted to a newborn fetus during delivery if sores are present at the time. Next up are genital warts. They affect skin and mucous membrane growths caused by papillomavirus. They vary widely depending on the size and appearance and the serotype. Penile warts are usually hard to see. 90% of cases resolve within 2 years, and serotypes 16 and 18 implicated in cervical, oral, anal, and penile cancer. Okay, next on the list are fungal infections. We're going to zero in on candidiasis. This is an opportunistic infection of the vagina caused by members of the genus Candida, most often Candida albicans. This is a pretty common infection. About 75% of women experience this in their lifetimes. It is part of the normal microbiome of the mouth, intestines, and vagina. And antibiotic therapy or diabetes are predisposing factors. And the symptoms are itching and thick yellow odorless discharge. And it's usually treated with an antifungal along with probiotics.
Checkpoint 4. From the presentation, name 2 diseases that are precipitated by a disruption of normal vaginal conditions. And thank you all for listening. That concludes Chapter 23, Urogenital System Infections.